for this series. We've got Royal Lifesaving Society Australia, who our presenter today works for. We have Commercial Aquatics Australia, OTM Sport and Leisure Planning Group, YMCA Victoria, the Victoria State Government Health and Human Services Department, Belgravia Leisure, Cleaning Melbourne, VACA, Aligned Leisure, our Watch Around Water partners, EcoSave, and Western Leisure Services. So today's presenter is in the aquatic operations stream. We've got Craig Roberts, who's the National Operations Manager for Royal Lifesaving Society Australia. Craig, amongst other responsibility, chairs the National Aquatic Industry Safety Committee, who have authored the latest iteration of the guidelines for safe pool operations. Craig has a background in lifesaving and emergency management, having been a general manager of Westpac Rescue Helicopters and a senior manager at Emergency Management New South Wales. The upcoming sessions in the series as well, just so everyone's across what's coming. We've got next week, we've got called recruitment and engagement with Ramsey Hussaini, who's one of our called experts at Lifesaving Victoria. Our Tuesday, the 5th of May sessions just had a change, so we'll confirm that shortly. We've got Craig back again the following Tuesday, talking about incident and emergency management. And then Tuesday, the 19th of May, we have the facility application of the supervision GSPO with Alec Olszewski from Western Leisure Services. So before we move into the seminar here, so I'll hand over to Craig, and Craig will present from his screen. So there might be a little bit of a pause as we sort of transfer presentations. If you have any questions, make sure you do drop them into the chat. We've got Craig has dropped a comment in there. We've got quite a few familiar names and faces in there, so please do drop a comment in the chat bar as well. Thanks, Craig. Whenever you're ready. You might be on mute there. Here we go.
Good morning, all. The presentation I'm going to give you today is I'm going to give you a bit of a combined project that we have been undertaking now for some time in partnership with a University of Technology in Sydney. A bit of background to this is that our pool lifeguard requirements within the pool lifeguard skill set have been around for quite some time. And they actually originated from Canada and the Canadian Lifesaving Manual and Lifeguarding Practices. One of the interesting facts about that is there's fairly limited research in this space around pool lifeguards, and in particular the current fitness requirements, both health and fitness requirements of a lifeguard. The second part of this research that really originated was from lifeguards that had injured themselves in aquatic facilities and were being assessed by medical practitioners in terms of their return to work duties. And we received a number of feedback through the Aquatic Industry Safety Committee about varying standards and approaches to that, and a lack of advice to medical practitioners in terms of what are the actual health requirements of a lifeguard in order for me as a doctor to sign off that that person is suitable for work again. And that may be suitable for work under their original conditions or under some form of modified conditions as well. What I'm going to present to you is stage 1 and part of stage 2 that has been done in this work, but there's actually more work going on as well. Before I do start, I do want to, this work's only been taken by myself, Amy Peden, but also a large part of it by Dr. Daniel Demant and William Lam from the University of Technology, Sydney. And certainly a lot of the work that we did in surveys and bits and pieces has been undertaken by Dr. Daniel Demant in that sort of space as well. So the full project, to give you a bit of a picture, is a 3-stage project. The first stage is an international literature review of not only pool lifeguard or lifeguard health and fitness requirements, but we also identified a range of organisations or a range of professions which have like natures. And I talk of persons in mines, fireys, police officers, search and rescue workers, those different types of professions across the world, and looked at a fairly broad international literature review in that space. The second bit, which is what we were at prior to our current circumstances, is field testing the results from that literature research in a range of lifeguard scenarios. Those lifeguard scenarios are a range of parameters: indoor and outdoor pools, 25 metre, 50 metre pools, in irregular shaped pools, as well as children and adults as different patients and different circumstances regarding the patient or the circumstances that may arise within a person being in difficulty in the water. The third stage, which we are bringing forth at the moment, considering our current circumstances, is we're convening a medical panel of experts in both a range of issues from physical literacy to exercise science to cardiac science, and a range of different professions who will come together and will validate the results of the research within the Australian context and within the comparison of other like testing methodologies in that sort of space as well. This is the scope of the international research. You'll see there's a number of large and smaller bubbles. So some of those are fairly significantly sized countries, where others are small geographically. But basically it's been derived from the Very High Human Development Index, which is a common index used in terms of the United Nations Human Development Program. The reason we did that is we needed results of pool lifeguards that were like Australian pool lifeguard conditions. A range of countries do have pool lifeguards or even open water lifeguards, but because of the Human Development Index, the circumstances, the training and the equipment that they use aren't necessarily applicable to us here in Australia. So we've taken that there, and we've also added a couple of additional countries which we know have had experience through the international life-saving work of a range of different things to do with pool lifeguards. So what was the research methods? And this is to give you an idea that there was multiple levels of research in the space. The first one was a legislation review. So there's over 30 countries that appear in the legislation review. In some countries, that's not necessarily legislation. It may be qualifications. It may be municipality or local governments. It may be Australian standards or international standards or European standards in some cases. In different countries, they have a range of de facto legislation as well, which might be our relevance to things like workplace health and safety standards. As part of that legislation review, we also looked at the range of research that was identified that related to that legislation as well. So there was a backfilling approach in terms of the research that had gone on in that area there. We also did 2 cross-sectional surveys. So those were of both organisations at a national level, at a state or province type level, and also at an individual level in pools in multiple countries across the world. That looked at their requirements and their qualifications for pool lifeguards, but it also took into consideration their environmental circumstances and some of the other practices that they have in place that may impact on a lifeguard's health and fitness in that sort of space. The other big one is the occupational standards. So like our workplace health and safety, different countries have different ranges of occupational standards, and not all the times are they lifeguard orientated. In some countries, they're actually the emergency services emergency service wide occupational standard, and that applies whether you're a firey, an ambulance, or a lifeguard, or anything else like that as well. So it's been a fairly robust literature research in the first part, and obviously we've looked at with many of the organisations here in Australia, their own health and fitness and physical requirements and job requirements as part of that process there as well. Interestingly enough, there's a fairly broad range of information that pops up in this type of area when you're doing a literature research. And one of the things that we had to do is specify or classify some specific categories based off that literature research and what the areas we were looking at. Physical fitness is and swimming ability were both separated and together in a range of standards, but we looked at a minimum age, which was fairly common across most countries as well. Training and qualifications, some of the health and fitness requirements are actually in the training rather than anything sort of separate. And then we looked at some specific areas. The visual and hearing are certainly the most common. Those areas of infectious diseases and chronic conditions, very prevalent where a lifeguard is performing first aid to another person, and some of the cross-infection and the circumstances that an individual patient may not want from a lifeguard. So there's some of the medical circumstances that occur there, but also those medical circumstances that may inhibit a lifeguard from performing their duty adequately at any one time. And the last one was character requirements. This has a fairly broad area, and it includes everything from working with children checks to police checks, which we typically know, but certainly in a number of countries, specific character requirements are minimum requirements for pool lifeguards. And it's in the same breadth or context as the health area as well. So we certainly had to take that into consideration when looking at all of the area in this sort of space. So I want to put some clauses in there to give you an idea in terms of the methodology. So this was a non-systematic search. So we identified the countries and legislation and regulation, and it's been based off those categories. So where a country didn't have one of those categories, we simply identified it. But we did understand that there was some countries whose research in this space or standards in this space were actually in a completely different area. There's a lot of language barriers and a lot of access to databases and websites. So it's been one of those processes that has taken some time simply to access the information, and a lot of writing to different organisations and different governments to understand that. But probably one of the hardest things is that a lot of this does not exist in legislation or standards. A lot of it is simply in training manuals or in individual organisational policies or procedures. There is also a norm that has appeared certainly through the European countries. The European countries follow a European standard, much like an Australian standard, but it has the lifeguard health and fitness requirements in that particular European standard. So a lot of the countries and a lot of the organisations' policy is simply to follow that European standard. One of the things that we looked at in terms of the development of the European standard and those that had been involved, funnily enough, it was actually a group of people around a table that came up with the European standard, and not necessarily a robust research methodology for that standard. It was based on existing organisational protocols in the development. Through that process, though, we also identified that there's two countries, both in Europe, who are currently doing similar research in this space. So we've agreed to partner with those two countries, one being the UK and one being Denmark, who have, and we are sharing the results of the different parts of research as well, and hopefully down the track, I will be able to share some of that stuff with you as part of it. So just broadly, 17 different organisations, 50 different public and commercial pools, and their different practices, and 20 different countries in that sort of space. This is the table that gives you an idea of those 8 categories. And the 3 different colour boxes there. So I'll let you have a bit of a look at that. Obviously, all the countries down the bottom. The first line is actually what the International Lifesaving Federation recommend. But as you can see, there's a fair few countries who have a legislated minimum standard for lifeguards. A fairly broad range have a grey in terms of the de facto minimum standards, and then no legislated, especially in those health conditions, is quite prevalent, other than the physical fitness and training qualifications in that sort of space. So if you think of Australia in this sort of space, to give you an idea of where we sit with this area here, it's only through those de facto minimum standards, industry standards and insurance requirements for pool lifeguards that we really have any of these requirements. Where it is legislated, it's actually legislated that you apply those standards within your state and territory. In that sort of space. So we certainly mainly have a grey box or a blue box in that area there. Currently, the GSPO looks at physical fitness, minimum age, training and qualifications, visual and hearing impairments, and only a couple of infectious and chronic conditions. And character requirements is only in that category in terms of the police checks or working with children checks as well. So it certainly paints an interesting picture. If you're interested in some of this stuff, the full published report will be out soon. It's certainly pending at the moment with the university that sponsored part of this research to be published in this area, which you can find a lot more about all the different standards and how they came about and some of the research behind each one of those states and territories pieces. So what does the picture look like? These are the initial findings, and I'll also talk about fitness here. As a result of this, we excluded the category in terms of training and qualifications. The training and qualifications were different in every state or territory, every country or province, but also they weren't necessarily. They're either aligned to the international life-saving framework or they're above and beyond that international life-saving framework. So we did know some of those areas that were in place with that, and it really wasn't the key outcome of this research. So in terms of age, most countries have 16, and there's enough solid research behind a 16-year-old. But certainly that personnel under the 18 under constant supervision is quite common in most countries in that sort of space, similar to what we have here in Australia. Also, there was a number of references similar to what we deal with is that 18-year-old is that minimum age for an adult, and for a broader range of issues that involve an individual and the classification of a child under that age as well. In terms of vision and hearing, one of the basis for this research was that we took in the research that we do know about how many 25-metre pools and how many 50-metre pools and how many irregular shaped pools there are in Australia, and noting that the majority are of a 25 or 50-metre nature, and that ultimately a lifeguard would need to see or hear a drowning victim at the other end of the pool or the other corner of a pool in order for their role to be effective as a lifeguard. So that was the basis behind what the vision and hearing areas are there. So for those of you who are not aware of, you're probably aware of the 2020 type range. The Snellen eye chart is a international standard in terms of Snellen eyes that Australia does use also, and that sighting suggests the 6.9 or a corrected 6.6 rate for your vision in that sort of space. And then in particular, they looked at two particular areas, which was the monocular vision and the visual field defects. And this is quite common in a range of other professions which have sighting as a role of their profession. And I talk about those persons like pilots, mining safety officers or fireys or anything like that, that have a distinct visual role in what they do and how they do as well. In terms of hearing, as you can see there, a hearing loss no greater than 40 decibels in any frequency between those 2 kilohertz of the 0.5 to 3 kilohertz. So that's something that quite commonly can be tested at your local GP as well, in that sort of space. And most people would have that hearing. It's only when you've had some form of hearing loss throughout your life, either through birth or throughout an accident, that 40 decibels may be affected as well. One of the challenges in this space that the research team looked at was also the fact that a drowning victim often doesn't make too much noise. And for those of you who know, there's a whole science between how your hearing is intensified when you don't have vision, and vice versa. So that was actually taken in consideration, and something that'll be looked at through the medical committee as well. In terms of infectious diseases and chronic conditions, there's a number in this space that in Australia we really haven't looked at, or we haven't had in place for a number of reasons. But more and more, these are becoming the norm for professions like a pool lifeguard. Certainly untreated chronic waterborne infectious diseases is something specific to those working in a water environment, but a range of other organisations have that. Bloodborne diseases, typically when we're dealing with first aid of patients in both their health and safety and the lifeguards' health and safety. Certainly balance affecting disorders, so where your middle ear essentially is affected in any way or another, and there's certain conditions or medical conditions or diseases that affect that at different ranges as well, in that sort of space. And then there's the vaccinations against Hep A and Hep B in that sort of space, and hopefully COVID-19 is not one of those ones that are there as well. In terms of the character, full criminal background check and the working with children check relative to the Australian context is what was drawn out from those character requirements as part of that. The next part is actually the fitness part. So typically this is both a combination of what the international standard is, but also the next slide that I will show you, and how we're actually drawing some of these issues out. Typically at the moment, swimming 200 metres in less than 6 minutes is what the pool lifeguard is in Australia, or those who've done either a Royal or Surf Bronze is the swim 400 in 8 minutes is typically there with the rescue space. There's a fair bit of evidence through the international literature research that there is a distinct need for someone to be able to swim 50 metres in less than 50 seconds in order to reach a patient quicker, but actually have the endurance of the 200 metres or the 400 metres while they're in the water, managing the patient and returning to the pool edge as well. And that's something that we currently don't have here in Australia. A common area in terms of retrieving an object from the deepest part of the water, no greater than 3 metres. Obviously a challenge with those facilities that have springboard diving and the arrangements that go with that, but certainly the 3 metres areas is quite common Certainly, it's in the European standard in the international life-saving federations area of those different aquatic environments. Treading water for 3 minutes is based on the average time in which you would average to maximum time that you would spend with a patient treading water. The endurance of the swim and the at the 200 or the 400, and then the responding to the simulated scenarios in terms of the context, which is not too different from what we did. The next slide here is really where we're taking this further into this space. If there's anyone on the system from Geelong, you'll certainly notice this type of graph that originated. We've done a lot of upgrades in terms of some of the baseline information and research in this space to give you an idea of how this lifeguard fitness can also inform things like our lifeguard supervision in this sort of space. The diagram, for those who can't actually understand it, this is a 10-lane Olympic swimming pool. So the broad line there is an Olympic swimming pool. Each one of these lanes is at a 1.5 metre width. So the standard Olympic swimming pool, noting that a range of swimming pools are at 1.2, and everything in between in that space. This particular graph, we've actually done 9 of these graphs of a 50-metre pool as well as a 25-metre pool. So this is the distance down the side here, where a lifeguard is standing either at the corner. The other scenarios have them in the middle here or along the side at different locations to see if the results change in that space. The figures in the middle are the time it takes a lifeguard to reach a person in the water at the furthest most point in that square. So for this particular square here, we're talking about this corner there for the lifeguard here in the corner to reach that person. We note that there's multiple ways to reach that person. So from a baseline, we've been using the provisions that the science is that the average brisk walking speed of an adult male 20 to 29 is 4.89 kilometres per hour or 1.3 metres per second. We haven't taken into consideration that you would run in an emergency situation. We've taken the baseline as an average brisk walking speed, and interestingly enough, the average brisk walking speed of a female between the 20 to 29 is actually slightly faster than a male.
Craig, sorry to interrupt you here. Can I just confirm that the width of the lanes is a FINA standard 50-metre pool, 2.5 metres width for the lanes. Is that correct?
Sorry, yes, you're absolutely right. Did I say 1.5?
You did initially, but I remember from the last time we spoke that it was a FINA standard 50-metre Olympic pool. So yes, 2.5 metres width for each lane.
My apologies.
All good. Thanks, Craig.
So what this demonstrates is also that this is based on the lifeguards swimming 50 metres in less than 50 seconds. So the rate in which a lifeguard swims metres for 50 seconds. So it paints an interesting picture. What the 3 colours are is that there's already a baseline in research that we know from a drowning victim that 30 seconds is the magic time in terms of the rate of detection. The average drowning victim falls below the water at 30 seconds with no signs of drowning. Now that's an average. Obviously, some people happen instantly, some people happen longer than that, but there's some fairly solid international research of that 30-second detection area. So we've taken that as the baseline, the 50 metres in less than 50 seconds, and the average brisk walking speed to come up with this table in that space. As you can see, these numbers here are based on this lifeguard going along pool deck using the average brisk walking speed and then swimming across to the location at that same speed of the 50 metres in less than 50 seconds. Now, obviously, there's a lot of different factors that take into consideration here. Clothing, how you enter the water, how many people are in the water, whether there's lane ropes or not lane ropes, or there's other activities in that sort of space. So we've noted that they are all considerations that would have to be taken in consideration with this, certainly in the field testing as well. But as you can see, it's very difficult for a lifeguard to reach almost half of a Olympic-sized swimming pool in less than 30 seconds. Now, that's if they've detected the individual drowning at the point of 0.1 seconds from then on. So if they've missed the first 10 seconds, then obviously that red starts creeping over even further. So these numbers also obviously move depending on where you put the lifeguard. If you move the lifeguard here to the centre lane, there's obviously multiple ways. They could swim straight down the lane, they could walk and go diagonally or straight across as well. So there's various options in which they may do that. But what we do know from the various scenarios is that it is actually better for a lifeguard to be standing on the corner rather than in the middle as well. You actually have more squares in the red using this methodology with a lifeguard standing in the middle. And you get this sort of effect where it becomes a curve in the water where they are unable to reach the patient in that sort of 30-second time frame, or that benchmark in terms of the 30 seconds. So this is some early research in this space, and certainly some research that needs validation. The intention of the physical testing in this space is to have a range of lifeguards, both experienced and inexperienced, to identify a patient at different locations within a standard swimming pool, both indoor and outdoor, and whether that changes the test. A range of conditions in terms of those lane ropes or different persons in water, whether rescue tubes are on in their hand or on a pole, typically where they are in different circumstances, and obviously the removal of clothing or going in the water with clothing, or removing of simple things like a radio and a bum bag, which is quite common obviously for a lifeguard. So that's what the next steps are to try and validate this, and then also take it into a 25-metre pool, and then look at some specific testing for a range of irregular shaped pools that are more common within our industry as part of this process. As you can see in this area, it becomes quite difficult to, as I said earlier, to have one lifeguard look after the area. But what happens when you put 2 lifeguards on the corners is that you still have a small area there, but if you change the lifeguard fitness test to 50 metres in 45 seconds, you get coverage for the entire pool every scenario as well. So those are some of the things that we need to look at and need to validate, and then obviously come up with a position with and engage industry about some of the best ways in which to apply this knowledge and this science, as well as the practical environment that we all sort of know and deal with when we don't have a nice square swimming pool. The next stages of this is this information will be presented with the trials, the physical trials, to both the medical panel and the National Aquatic Industry Safety Committee. They will deliberate on all those areas. A draft guideline based off those results will be, well, a new one or a revised one will be in place, and then obviously that'll go out to industry as per normal with any sort of guideline, and we'll also take that to the Industry Skills Council, where the fitness and training places in as well. Happy to take any questions, but that's basically it from me, RJ.
Hi, thanks, Craig. That was there's been quite a bit of feedback coming through. I don't know if you've seen the chats, but
Just seeing
people
it now.
really liking the 50 meters in under 50 seconds. We've got interesting information, great data, recognizing the fitness aspect. Question from Alex Caldwell in New Zealand. He's asking if there's any consideration for using these graphs for particular pools to show response time. So I'm assuming, Alex, you're asking if there's a template or something that could be adapted. Is that your question, Alex? Please drop a little bit more information into the chat. He said, in line with your comments, RJ, can the tool be used to plan placements of staff to ensure that times to respond are minimized as much as possible? So I guess he's asking, Craig, if we could make a resource available to industry. I think I might leave you to answer that, but initially probably it's a yes from me.
Yeah, look, absolutely. That's something that we'd be looking at doing, and given the range of scenarios which we've already done in that space, you'll be able to see where if you change some simple numbers of the width of the pool or the width of the lane, sorry, or the amount of lanes. We've also done an 8-lane pool versus a 10-lane pool. You mean the 25, 50 meters. So there's obviously a few different versions there, but that is the intention of being able to do that to assist, not necessarily from a fitness point of view, but certainly from a planning point of view. Yep.
We've got another question here. So it's just confirming that the 50 meters in 50 seconds was measured in bathers, or is that like a fully clothed swim, which would be reflective of a lifeguard on duty?
So it's interesting enough that what the research identified is that those countries that are doing the 50 meters in 50 seconds are doing their testing in both swimwear and clothing. So this is one of the areas in which we would need to validate those results in swimwear and in clothing in that sort of space. Obviously, the swimwear is going to be easier and quicker. But as we know, it's not necessarily the case that a lifeguard will strip down to swimwear in every time, and especially where the patient is a lot closer to the lifeguard. They may simply just remove the radio and that's it.
We've got quite a few questions flying in here, Craig. So thanks for bearing with us as we sort of rapid fire those. So we've got John Clark, Brimbank City Council. Which country region do you feel is really leading the way in terms of lifeguarding standards and performance?
In terms of pool lifeguarding, there's probably 4, I would say, that are leading the way. Certainly the UK, which is one of those countries in which we've partnered with have got a range of research projects going on. It's probably not reflected in their practices right now because they've commissioned a lot of work in this space, but I certainly think some of the work that they're doing is really groundbreaking, and I presented at some previous conferences, which you may want to look at in some of the stuff they're doing in terms of video sequencing the drowning victim in public pools based off a range of CCTV cameras that footage that they've used as well. The other one is Canada, and we work on a dual project with Canada at the moment in terms of some lifeguard research in this space with them. And certainly the other one is the United States. So the United States have had a range of performance and standards in this sort of space as well. One of the challenges with the United States is a lot of the lifeguard performance doesn't take into consideration the design elements that we've put a fairly large emphasis on here in Australia. So they don't necessarily have the strong mitigation measures in their design elements or their facility standards that we do have here in Australia and in the UK, certainly.
Thanks, Craig. That's really interesting. I'm sure there's a lot of people really interested in that information. Guys, just a reminder, you can show the conversation by hovering your mouse on the center of the screen. There's a button, looks like a speech bubble, show conversation, drop a comment in there. I've had a couple of people mention that their browser or the way that they're accessing Teams doesn't allow them to comment. If you send an email to assessments@lsv.com.au, I am monitoring that inbox currently. If you do have a question, you can send that through and I can read it out. Otherwise, we've got another question here. So in regards to having someone over the age of 18 supervising a lifeguard under the age of 18, do you have to have all lifeguards on pool deck over the age of 18 or someone, sorry, on pool deck over the age of 18, or is having a duty manager on site sufficient?
I'm guessing that's a current GSPO question, not necessarily the revised research, which is actually not too much different there as well. Under the current GSPO is you must have someone over the age of 18 who is the actual person responsible for the safety of patrons at the aquatic facility. So it's actually someone's got some fairly large background noise. It's actually best worded the other way around, is that you supplement that individual.
Craig, sorry, you'll have to unmute yourself. I had to hit mute all just because of that background noise. You might just need to unmute and rewind. Sorry there.
Yep, sorry, RJ. So the GSPO says that you must have someone at the age of 18 at all times at an aquatic facility, and certainly that is been further supported in the Aquatic Industry Committee with some of the Royal Commission into child sex offences recently, obviously for other reasons as well. But the actual fact is that you supplement that role of that person who is responsible with additional lifeguards, and those lifeguards may be 16 years or older. So ultimately, you do have to have someone who is there. If your duty manager is qualified as a pool lifeguard, then obviously they have that responsibility, can do that role. But if they're not qualified as a pool lifeguard, then it is very difficult to be able to perform that role.
Okay, we've got some further feedback from those that ask questions, and
Yep.
Mostly just thanking you for your response, and John mentioning, it's great to know that in Australia we're being leaders with considering safe design. Adam Kavanagh is asking if the swim times were to change, is there any suggestions how we would implement that with current staff?
Yeah, look, this is something that we know would impact the industry if we were to implement these recommendations. That's why we're both doing the field testing as well as the medical expert panels to ensure that whatever the research comes up with and what are the recommendations ultimately that the Aquatic Industry Committee agreed to is based off solid evidence. In terms of that space, there's two different elements. We can change the GSPO, but lifeguard fitness requirements are also within the skill set, the pool lifeguard skill set, which is managed by the Sport and Rec Industry Council. Fortunately, I sit on that Sport and Rec Industry Council, and we have an influence over that in terms of the aquatic industry and that sort of space. So it would be a dual process where those documents, both the skill set and the guidelines, would need to be changed, and then there would be an implementation period for new and existing lifeguards over a period. And that implementation period is something that the aquatic industry discuss and debate, and there's no necessarily suggestion or recommendation for that at the moment, but that may be anywhere from 3 to 12 months generally. For other stuff, it's been 18 months that takes to implement. Obviously, with this sort of side of things, it would take a minimum of 12 months because of the currency requirements for a pool lifeguard. But those are some of the things that are being looked at in that sort of space.
Okay, we've got another question here around It's kind of there's two questions actually that have just come through that are quite similar, and maybe I can assist with some clarity here. So we've got one question: if you only have one lifeguard on pool deck, does a lifeguard need to be 18? And I guess the what's not asked there is, is there someone supervising, as in a duty supervisor, who is over the age of 18 or not? And then the other question was, facilities that are looking at eliminating duty supervisors, duty managers, should the manager on duty, hold pool lifeguard qualifications? I think the answer to both of those questions is essentially you need to have sufficient pool lifeguards and sufficient pool lifeguard qualified people, and you need someone in the facility that's supervising the lifeguards that are under the age of 18, who is over the age of 18. So I think that's pretty clear in the guidelines. One other sort of element, just to clarify, is just, Craig, as you were going through your presentation, you were showing the lifeguard in the corner, and you mentioned having a lifeguard in the corner is a great place to have them, because you get more area in the green and in the yellow than you do in the red that way. Just to clarify with listeners, if you read through that supervision section of the GSPO, you need to be analyzing not just one element, which is respond and reach, but you need to also analyze, who the users are, what activities they're doing, what are the inherent sort of environmental or design features that create, line of sight barriers, et cetera. So your supervision planning, your deployment planning needs to consider all of those various risk inputs to then develop that plan. So just having, two lifeguards in opposite corners on a 50-meter pool doesn't necessarily mean that it's fully compliant or it's safe. You need to be looking at the activities, who's in the space, are there high-risk users, what inherent, environmental factors are there, such as glare, line of sight, et cetera. This is just one factor and one facet that you should be looking at. So just to add some clarity there for listeners. I'm sort of looking for any other questions there. Is there any? We've got Nara Breton has asked, are we likely to see, or when are we likely to be able to use the response times as in-house training documents? Craig, are you happy to field that question?
Yeah, certainly. So what the research will do is, so we have to validate these times and these distances. We also have to be able to provide this in terms of the 50 metres in less than 50 seconds is not currently a standard within Australia. So this would require that to be a standard within Australia in order to be able to be used. Also, there is there is argument over it's 45 seconds or it's 47 seconds, and that changes the dynamics of that accordingly in that sort of space. So as soon as that sort of work is finalised and validated, both by field testing, medical practitioners, and the industry itself, these will certainly be tools that will be open to anyone in the industry to assist them in their supervision planning. And we have no intention of hiding any of this information. It's not necessarily a complex spreadsheet. It's an Excel spreadsheet, but there's certainly some formulas behind there taking into consideration some of that information. And we'll make that readily available as soon as we can verify the results.
Thanks, Craig. There's a few questions coming through right now. Rose, it's kind of a very broad question. What's the drowning rate worldwide? It's quite a big question. Some of that data is available through various drowning reports at various national life-saving bodies. So that, but I don't think Craig or unless, correct me if I'm wrong, Craig, but it's probably a little bit too broad and too hard to just pull a figure out of sort of the world drowning rates and respond and reach times. Maybe you have an answer there, Craig. Katrina, there's a question around school programs and learn to swim classes. Yes, if you read the GSPO section on supervision, lifeguard supervision, or certainly someone with the lifeguard skill set equivalent is required when there's swim lessons and public swimming, so or classes. So you need to read through that information. Adam Kavanagh said, based on the graph, it would suggest that we have 2 lifeguards in a 50-meter pool at all times. Essentially, Adam, that's what the data is suggesting, that 1 lifeguard cannot respond and reach within 30 seconds on a FINA Olympic-sized 50-meter pool. So that's essentially what's being suggested here, unless you restrict access to parts of the pool or close particular parts of the pool at quiet times or quieter periods. You need to think about the programming and or the resourcing to keep people safe. So we've got Andy's just dropped a comment. There's been no drownings in public pools in Victoria in over 250 million visits, which is significant. So certainly in Australia and in Victoria, leading the way there in drowning prevention in public pools. I hope that's sort of answering questions for people. I don't know, Craig, if you've got anything for Rose there around a sort of drowning rate as a worldwide benchmark. I'm not sure if you've got any additional information there.
Yeah, look, Ros, in terms of the drowning rate, some basic things. Drowning is the 3rd leading cause of unintentional injury worldwide. So that's 7% of the total world deaths of injury-related deaths. That magic number is about 320,000 a year worldwide. But that's certainly an underestimated figure, a significantly underestimated figure. And as in within Australia, children, males are most risk in that sort of space as well. One of the challenges in this sort of space is certainly that the varying standards of public pools is quite a challenge in this space in terms of who and how a public pool is classified, and really public pools don't factor highly in a lot of countries, undeveloped countries. Certainly drowning is a bigger issue in open waterways and areas where they are trying to access water for sanitary reasons or for drinking water and the like, and the drowning issues associated with that in that sort of space. We do know that the drowning rate in Australia is an average of, 5 years ago it was an average of 3.2, and we're now at 1.2 a year. So that's something that's certainly to be commended. And from my perspective, a lifeguard's fitness is the absolute last resort. There is an extensive range of mitigation measures that we put in place within Australia, and the safety of our pools is certainly commended worldwide in what we do and how we do it, so that our people who attend our facilities are certainly safe in what they do.
Okay, well, thanks so much, Craig, for your time today, and also in the upcoming sessions. I've had the privilege of hearing some of Craig's presentations in advance. We all of our state and member territory organizations at Royal Lifesaving, we met in January. So there's some really good stuff coming, guys. Thank you everyone who tuned in today. We've got a lot of really positive feedback, and to be honest, this is one of our sort of most highly engaged sessions. We've had the most, certainly the most questions and comments, and I think that's really a testament to the operators that we have around the industry here in Australia, that people are interested and they want to make sure that that they keep people safe in pools and keep their lifeguards at the highest standards possible. So I just encourage everyone, again, drop us some feedback, assessments@lsv.com.au. You should be able to see that in the slide now. We'd love to hear from you. If you've got, a colleague or someone or yourself who's interested in presenting a session, or you've got a particular take on an interesting issue, don't be shy. Get in touch with us. Likewise, if you've got any sort of feedback or additional follow-up questions that you'd like either us or Craig to have a look at, please let us know. Craig, thank you so much again for your time, and thank you everyone for listening in.
Not a problem. Thanks, guys.
I'm going to stop the recording, everyone, and you can just hit the little red hang up button on your screen, and I'll close out the session in about 3 minutes. Thanks, everyone.